Hello.
Hello, hello. We'll wait for
So,
5 minutes
yeah,
for people to
we'll
join.
wait for people to join. Yeah.
Hi, hi everyone. Thank you for joining. Yes. Yes. I think we can begin.
Yeah.
So, hello everyone. Let me introduce you to Dr. Deepika. So, I'm very happy to have all my classmates and friends on board. They are excelling in their field and so happy to join them. Yes, everyone say hi to Dr. Deepika. Whoever is online, just say hi to Dr. Deepika. Let us welcome her. Yes, thank you, Anusha. Happy Doctor's Day to you too.
Thank you, Anusha.
Yes, we'll begin. And before beginning, I wish Dr. Deepika a very happy Doctor's Day.
I wish you too the same, Apurva. And I'm so glad that we actually organized this session on this
Yes,
day, particularly on
yes,
this day.
yes.
So, should
Thank you
we
so
wait for
much.
people or
Thank
can we get
you.
started?
Gauri Mukha is saying happy Doctor's Day to both of us. Thank you so much.
Yeah, Gauri.
Yes. Thank you, everyone. Okay, so before beginning, let me introduce you to Dr. Deepika. She is currently working closely with cancer patients, and she is working in a rehabilitation for cancer patients in a leading cancer chains in Bangalore. So today, when we decided to speak about cancer, because there is a lot of rise in cancer cases nowadays, we see a lot of cancer, every family dealing with cancer. So we decided to give awareness, and who best to have other than Dr. Deepika today to speak about cancer. As naturopaths, budding naturopaths are looking for information, and they can learn more that how naturopathy can be applied in different aspects as an integrative medicine. So excited and happy to have Dr. Deepika on board, and let us begin our session.
Thank you. Thank you for that introduction, Apurva. And I welcome all of you for this session, basically. And happy Doctors' Day for all the doctors who have already joined. And today, as we've already said, today's topic is cancer. And we are here to speak on naturopathy's role in cancer. So we see recent mortality rate if you take out. So you see the number of deaths in globally is more with non-communicable diseases and cancer leading a very big what to say. I mean, these days you see every person, every family is having one person at least in their home diagnosed with cancer. Right. So we thought this will be a great initiative to educate patients to have to combat cancer, and also we were intended to speak on cancer because we wanted to inspire and educate budding naturopaths to explore this arena. So that's our intent. So let's not waste time. Let's get started with the topic. Today, if I have to tell what is cancer in a layman terminology, cancer is like it is a non-protected or cell division that is not controlled. Like in a the layman terminology, uncontrolled cell division is cancer, and every part of the body is potentially you can get cancer in any part of the body. So basically, you will have to look for your lifestyle changes and all of that. So it is a preventive aspect of cancer. So conventionally, we have so many other treatments once the patient is diagnosed with cancer. So we'll just look forward with the questions that we are getting into the session.
Yes.
Yes,
Yes. As we
Purva, if
came to
you
know
want
what
to
is
ask anything.
cancer, like what is it is an uncontrolled cell division. Basically, your cells are growing every minute, but in cancer, it is like uncontrolled. There is a lot of
Yes,
number of cells growing than the normal. That is what Dr. Deepika said. It is that we can understand in a normal terminology.
exactly.
What are the cancers? Like which all body parts can it affect? in general?
As I said, you cell division will actually happen in every part of a body, right? So every part of the body is potentially eligible to get cancer, depending upon the stimulus that you give. For example, a person who is working in a chemical industries can expect with a lung cancers or skin cancers and all of that. A person who is into the tobacco, right, sorry, for the person who is actually having a history of tobacco can be expected for oral cancers. So these are the things like if you take a prevalence of cancer, I'll have to tell you the prevalence and statistics of cancer globally. Uh, 1 in 100 patients in 1 lakh are being diagnosed with cancer. Crudely, if I have to put it in words, it's like 1 in 9 person is getting diagnosed with cancer. It can be any form of cancer. It's not any specific cancer. But leading cancer in adults are lung cancer and breast cancer. So again, if you see for the lifestyle disorders, lifestyle changes, for example, lung cancers, basically you will have habit history in place, right? So it is all preventable. If you are educated, if you are aware of your lifestyle, you can prevent it. So breast cancer, these days we youngsters are career driven, right? We are postponing our marriages. So you postpone your marriage, and in 30-35 years you get pregnant and you deliver baby at that time, and the breastfeeding is postponed and all of that. This is one factor for breast cancer, one of the factor. And lifestyle changes, obviously, and the amount of food that we are eating, the processed food and all of that, so that also should be taken care of. So these are two leading cancers in adults. For in childhood cancers, leukemias are very common in childhood cancer.
Okay, like leukemia as in blood cancer.
Yes, blood cancer,
Lung cancer and the breast cancer is very
breast
common in
cancer.
adults. As you already said, like the lifestyle change has been a major impact for causing of these cancers. So, what are the other factors which cause cancer? What is the cause of it?
So basically, if we see according to medically, so there are two different causes. One is environmental factor. The second one is genetic factor. See, in genetic factor, by default, you know there is a genetic mutation. You cannot do more for it. It's better you be aware of it and postpone the diagnosis as much as possible. If a person, for example, in breast cancer, there's something called HER2 mutation. So if the person is running out with this, if the family line is running down with this genetic mutation in place, so by default, every person in that family is getting breast cancer. So it's just that when you are aware and prevent it, if you take proper measures, then you can postpone the diagnosis. But by default, in any part of a life cycle, you will definitely be diagnosed with that. So more of these days, they are actually going for genetic counseling and all of that. They predict if there's any cancer in place in the family, they predict and they suggest patients to prevent it. So in environmental factors, 80 to 85% of cancer is contributed by environmental factors. That is what I can say. Example, like one of it is tobacco usage. See, tobacco usage can cause cancer right from the oral cavity to lungs and whatnot. So either it will directly cause cancer or it will decrease the immunity in cancer patients. For example, if you're trying to take chemotherapy, radiation and all of that, so it's very unlikely for a person to react better in cancer who is having habit history in place. So that will definitely play a great role in that terms. So tobacco can cause oral cancers, lung cancer, and all of that. So for a healthy individual, see, unless and until you find a cyst in your buccal mucosa, you don't understand the value of that healthy part, right? Once there's a cyst and then you go for an operation, you put a flap and then you go for chemo, radiation, on all of that, then you realize, oh my, being healthy was so important. We don't realize tobacco, if we just say patients not to have smoke, not to go for smoking, they would say 1 cigarette a day, that wouldn't make much difference, right? Probably a person who is having 10 cigarettes per day is very likely to have diagnosis in early age.
Yes.
In either of the thing, you will be diagnosed with it, but you are postponing it if you prevent it. That's all.
Correct.
The
When we
second thing
say
is, yeah.
when we say people like just avoid smoke or tobacco, the common answer is people are smoking every day and all of them aren't getting cancer. So I don't think that
Yeah.
is responsible. That
I
is
would
not
want to
fair
say,
answer.
I would want to add one thing here. As I said, it will directly cause cancer or it will decrease the immunity so that
Yes.
either you get cancer or heart issues and all of that. In either way, it is a threat. It's a threat to human existence itself. Alcohol. Second thing is alcohol. 3 to 5% of people who are into this habit are esophageal cancer. For example, esophageal and liver cancers alcohol contribute for 3 to 5% in these two cancers. So again, alcohol is a habit history which you can prevent. If you are aware of it, you can prevent it. So the next is virus. If you are infected for a longer period of time, example tuberculosis, HIV, and all of that, if it is not treated and if there's an infection for long-standing years, then you even that cancers, that viruses can cause cancer. Environmental issues like occupational hazards, person who is working, as I said, person who is working with closely with chemical industries and all of that, the each chemical will contribute to one particular cancer. So that's our occupational hazards. And dietary habits. So if you're not careful of what you're eating, all this processed and tinned and packed foods are potentially eligible to put you into cancer status. All GI cancers are directly related to your food habits. So food habits play a great role in this terms.
So
So
when
these
you
are
have
the environmental factors.
genetic predisposition is already there, and if you are getting exposed to these environmental factors like food and it may be smoke or unhealthy habits, whatever, so that genetic mutation, it gives a, like, what to say, like starting reaction. It ignites that
Exactly.
genetic mutation and then it definitely causes cancer, or it manifests in some other way.
Exactly. Yes.
Yes. So basically, even if you are having a genetic history of cancer, you can prevent it through good lifestyle habits or avoiding these environmental factors. If not able to
Exactly.
prevent, definitely you can avoid the severity of it. Uh,
Exactly. Yes.
yes. So, we spoke now about symptoms, like what are the causes. We saw that it affects the different organs of our body. It can basically affect any part of our body. So, what are the symptoms when one person is having cancer? What are the symptoms he faces?
So generalizing symptoms is a difficult part here. For example, for a person who is having tobacco history, I mean oral cancer, will have difficulty in chewing, difficulty in having food and all of that. So I cannot just say one single a bunch of symptoms for any for but probably we can just go for the general symptoms. For example, unexplained weight loss, unexplained soreness and joint pains and all of that for long standing. Given that you have run the blood tests properly and still you don't find any normal general checkups, I'm telling, not the oncogens, not blood markers and all of that. If you run a normal blood checkups and there's nothing uh, I mean, you're not finding out anything, but the symptoms are in place for a longer time. For example, unexplained fever for months together, weight loss, fatigue, nausea, vomiting, and bleeding, lumps in any part of the body, and bleeding from any part of the body unexplained. There's no stimulus. So
Okay.
these are the general symptoms.
Okay. Basically, if we have any unexplained symptoms for a very long duration, like whenever we have a long duration of even fatigue or tiredness, we may say, or a fever, we generally go to a doctor and all the things are ruled out. Even after ruling
Exactly.
out all the blood test or any related symptoms, everything after ruling out, if we don't find out the cause, probably it may be a cancer. Yeah.
Exactly.
So that is how we will get to diagnose cancers after a long duration of going to doctors and then ruling out, especially after ruling out all other causes of that symptoms, only then we can diagnose cancer.
Exactly. Yes.
Yes. After we spoke about symptoms, now we know that general symptoms, it can start with a very general symptoms like fatigue or vomiting or nausea for an unexplained reason. So till what extent can it go, these
The
symptoms? Like,
symptoms, is it?
yeah, if the person doesn't go to a doctor or it is undiagnosed, left undiagnosed, then it can reach to
Yes. So this is a very valid question. So it's very important for a person to admit the symptoms to a doctor. When it is sustaining for a longer period of time, you better go get checked. Otherwise, it's very difficult for a physician to cure or to manage the disease, for example, per se. For example, if you detect a cancer in early stages, it's very unlikely that a person can, depending on the system of cancer, it's very I mean, the person can have a survival rates are more. Or if you postpone the symptoms and all of that, like if you don't detect it properly, don't get tested properly, it might advance, and it might not be able to I mean, the physician might find it difficult to cure that or treat it better. It's very difficult to treat a person with a fourth stage of tumor, right? So it's like massive destruction. You have to take out a great chunk of a tumor. With that comes with a great chunk of a muscle is taken out. So it's a very morbid thing. And chemo also can go very aggressive because you are diagnosing only it in the final stage. So it will be very difficult for a physician to rule out protocols.
Yes. For example, when we say in women, we suggest them to do breast examination very often, frequently, so that if there are any lumps or anything in the breast seen at the early stage, it can be treated well. But many of them fear from saying that.
Exactly.
It
That's a
may be
taboo.
the
In fact,
side
yeah.
cancers for that matter. They may just
Yes.
think some food which is causing them a lot of bleeding or some hormonal imbalances, and they just don't go to doctor. That is very
Exactly.
important that we do early detection. In any disease for that matter, early detection plays a very important role. You may have to attend the less therapy sessions or less dosage of medications and less complications for that matter. You may even able to prevent surgeries if you go for early
Exactly.
detection. So early detection is a very important factor, as we know. So after speaking about the disease, we know what is the symptoms, and we can have cancers of what all parts. Now we understood. After that, we'll move on to the treatment part. So what are the conventional management of the cancer?
Yes. Knowing about conventional management makes a great difference for us as a naturopaths because we have a great role in playing in all of these interventional period, right? So early detection can, for example, I would just say surgery is a allopathically also surgery is a first line of treatment. So there is no substitute for surgery. When you see the tumor, you just take it out from the body and go for chemo, radiation, and couple it with alternative medicine. Example, like naturopathy can go with any of these three treatments because there's no side effects, right? And there is no invasive treatments that we give. So it's better managing it with naturopathy treatments, therapies, and going with a conventional medicine. Coming to conventional medicine, there is surgery and followed with chemotherapy and radiation. We are saying this only to give a awareness for the viewers. So it's not that we're promoting the system and all of that. So in chemotherapy, these days, so gone are those days wherein they would say cancer would never be cured and all of that. But these days, early detection and the progression in pharmacological industries, we have a high chances of curing the disease or managing it. You give a good amount of period for a patient to, even after the surgery, there are patients in oral cancers. There are patients who have lived for another 20 years, 15 years and all of that. Given that their treatment is all in place, they follow up better and go for a right diagnosis. I mean, repeated diagnosis or follow-ups and all of that. So in chemotherapy, they have targeted therapy, immunotherapy, hormonal therapy, and all of that. So it'll actually decrease the amount of destruction. In a chemotherapy, it's like generally they give chemotherapy, right? Whereas in targeted therapy, they go into the drug wherein it'll only uh, go or act on the mutated gene.
Correct.
It's not that it has to go act on every single part of a cell.
Lesser
So
amount
in
of
that matter,
because it acts only on the cell which is causing cancer.
exactly. Yes. hormonal therapy, immunotherapy to boost their immunity and all of that. Radiation, as we know, radiation is given to take out the cancer cells, I mean debris and all of that. After surgery, there will be some circulating tumors that is taken out with chemotherapy. And if at all, if there's any left out carcinogens in place, they would be getting rid of by radiation therapy. So these are the conventional therapies that is in place as
Yes.
of now.
Speaking of conventional management is very important, as Dr. Deepika said here, because we are not any people who are claiming to cure cancer or just without taking any medicines or therapy. There may be some people who are specialized in that field, no offense to those people, but then having a conventional management for cancer is very important because the technology has been grown a lot. Now there are lesser complications or side effects of the treatment of cancer like before. Like before, radiation therapy and chemotherapy were having a lot of side effects and people used to fear for it. But now, as Dr. Deepika said, targeted therapies and all have come up, wherein only the cancer cells will be harmed and other side effects will be reduced a lot.
Yes, yes. Yeah.
And it is such a beautiful system naturopathy is. As we said, that naturopathy plays a lot important role along with conventional management. It is the beauty of our system that it blends so well with any other system of medicine. Even if you're taking any Ayurvedic medication, allopathic medication, or homeopathic for that matter, you can always practice naturopathy along with it so that it helps that treatment to work better, and also you can improve your quality of life. And it plays a very important role, naturopathy plays here. And we have to understand our limitations as well. Like some people just see in some videos or somewhere, and I don't know if they are real naturopath doctors or just claiming to be naturopaths. I'm not sure about it, but they are recommending some drinks or magic potions. If you drink, you can cure cancer or you can prevent cancer. So does it happen really like that?
So one thing we have to understand is even allopaths won't claim that they can cure cancer. It's just that management. So in any disease, you cannot just say that we can cure. So for example, in cancer, there's something called new normalcy. You don't put patient into their normal life back. There's nothing called going back to the normal. So they get accommodated, they get adjusted with a new normalcy. For example, as I said, I'm just coming back to the same oral cancer. Now let's take tongue cancer patient has been, they've just chopped out a part of a tongue wherein partial gastrectomy is done and there's a flap there. You take out a different muscle of the body and place it there. So basically this muscle is not trained to act like a tongue muscle. So if you take out the function, if you try and understand the function of tongue, it is for chewing, it will help for mastication and speech, swallowing and all of that, right? So taste, definitely the new chunk of muscles that you are adding there can never taste a food. So you will have to train patients saying that this is a new normalcy. The half of the left out half of the tongue will just taste the food. The rest of the tongue is only helping for swallowing. We understand that swallowing is very great. It is very important, right? Otherwise, the patient can go for choking and all of that.
Correct.
So to avoid such complications, they stitch the muscle there. They give a new flap. So in that manner, management is something that we have to look
Yeah.
forward. And
The
then you also,
systems which are available for treatment are just basically doing management of cancer and not
exactly,
curing that. As you said, the new normalcy. We can never go back to normal like we were before cancer, but definitely we can improve ourselves and bring back to new normalcy.
exactly, yes.
Does that
So I would want to tell what, yeah,
naturopathy? Yes. How does
naturopathic
naturopathy and
role.
yoga help here in bringing back to new
So
normal?
all this a while we understood what is cancer and its prevalence and its general symptoms and the conventional therapies and place. So naturopathy, for example, let's try and understand what is health now. So according to WHO only, it's not merely the physical well-being of a patient, right? It's just physical, mental, spiritual, economical, and social. So you will have to touch all these five arenas to tell if an individual is normal, healthy, and all. all of that. In that matter, naturopathy will definitely play a great role in this thing. So it will give a better quality of life improvement. And in fact, naturopathy in cancer diagnosis can go with all these three different stages. For example, in preventive aspect, interventional, during any conventional therapies. For example, if a patient is going for a surgery, we understand diagnosis of cancer itself is a trauma. A patient, once they get to know about cancer, they feel suicidal. They don't want to accept the diagnosis at all. So you can start off with pranayamas and meditation and all of that. So mind body medicine plays a great role in diagnosis also. So you're preparing patient to take up surgery. So in turn you're trying to put their cortisol levels down. So we have a evidence research paper saying that patients who took up yoga before surgery, their salivary cortisols were collected, and they were given session, and they gave a operation, and they were underwent operation, and then salivary cortisols were again chucked. So patients who took up yoga, their cortisols were less. In turn, when the cortisol levels are less, the wound healing, as I said, surgery will include all this. Surgical trauma will always be in place. Cortisol levels will spike up. So when these are in place, your wound healing and coming back to the normalcy, like post surgical trauma, will take a long time to get back to the normalcy. So pranayamas will help in that manner. So in chemotherapy, side effects of chemotherapy, we see nausea, vomiting, fatigue, giddiness, and all of that, right? So cooling pranayamas, especially in naturopathy, we have cooling pranayamas, right? So they'll actually help patient to soothe them, to calm themselves down. It will help. There are papers. We have papers, good number of papers, which is showing the real scientific proof to patients who have already taken up pranayamas post chemo. There's something called chemo brain. Chemo brain is nothing but after chemo, patient will have cognitive impairment. So it might lead to sleeplessness, it might lead to confusions and memory loss and all of that. Of course, this is temporary, but still, some part of your brain will definitely not come back to normalcy after chemo. So this is all known. Even we have papers from allopathic uh, papers also. So yoga and pranayamas in this method, I mean in this phase, will definitely help them come back to the normalcy. Cognitive functions, we know, we have papers saying that meditation will improve cognition, right? We have given this to children's and all of that. We have given yoga for Alzheimer's disease and all of that. So in that case, we actually have a backup, evidence-based backup. So in radiation, you have this continuous burning sensation, like it is unexplained. It is very short. Short thing that a patient is going to tell you after radiation, after 33 fraction of radiation, definitely the patient is going to tell you that burning sensation is always in place. So in that manner also, no medications are there to relieve with this burning sensation. So pranayamas will go well, meditation will go well. Mind body therapies are playing a great role globally. Internationally, all of these cancer institutions are endorsing mind body medicines now. Integrative oncology is a need of the hour now. So acupuncture, reflexology, and all of these, pain and palliative care is also the main arena in cancer conventional therapy, right? So even any amount of morphine cannot put their pain down. So in that case, if you try out acupuncture, if you try out reflexology for a patient, it will give a great boost for a patient's confidence. They will actually feel confident enough to survive for a betterment. Quality of care is what we are trying to improve. So you cannot just treat a patient, I mean, do the surgery. Surgery might go well, but we have seen patients here in the cancer setup. Surgery would have gone better, chemo would have gone better, but down the line, after 2 years, there are patients who committed suicide because the quality of life was very bad. They didn't want to depend on their subordinates. They didn't want to depend on their family. So if you can put the patient post surgically in a better way of lifestyle, definitely it's a great service that you're going to give your patients.
Yes.
In that manner, will definitely work in all of these conventional therapies.
Yes. When we spoke about, as you said, cortisol levels are reducing after yoga and pranayama. Previous live session when we had, Dr. Caesar also was mentioning in the cause of hypothyroidism and in management that this cortisol levels, when it is aggravated, it causes a lot of disturbances in our body. It may be as a lifestyle disorder like hypothyroidism or to a deadly disease like cancer, it may cause a lot.
Exactly.
When we do this yoga and pranayama, the cortisol levels are reduced, as you said. This has been scientifically proven, what we are speaking about. We are not just claiming false things here. It is
Exactly.
definitely scientifically proven. As you said, it is not only a preventive aspect. Yoga and naturopathy is not only a preventive aspect, but definitely we can help in improving their quality of life, reducing their pain, and maybe we are also preventing the further damage or
Future.
recurrence of
Yes.
cancer.
Recurrence.
Yes.
Yes.
So, for preventive aspect, for the general public who is watching, who is not having cancer right now, but they want to be away from this cancer. So, what are the things they can do on an everyday basis?
So as I said, naturopathy is a holistic system, right? It won't definitely, we work on a root cause of a disease. So it's not just, you don't go and see a naturopath when the symptoms are in place. The thing is, even if the symptoms are in place, also naturopaths will go into the depths and they look for the changes of your body. Right with the bang on with the we have a blood reports and all of that, right? Conventional therapy diagnosis, with that, coupled with that, we have iris diagnosis, pulse diagnosis, tongue diagnosis. So these naturopaths will actually take a support of these diagnoses, traditional way of diagnosing things, and they give you treatments. They give you the customized nutritional plans, and they also give you hydrotherapies, acupressure, acupuncture, and all of that. So prevention is always better than cure. That slogan we have to endorse it at this point of time. That too for the cancer diseases like cancer, prevention is better. Any amount of treatment, even if you take very best standards of treatment also, there is no normalcy. As I said, there's no normalcy. You can never come back to the normal thing. So prevention is always better. In that case, naturopathy is best system of medicine.
Yes. Like when you speak about naturopathy, it is not necessarily that you just go and take treatments every day. It is what you can do at
Exactly.
home, and it is a way of living basically. Once you know the art of living your life in a healthy way, becomes your lifestyle. You need not go to the doctor every now and then. It just becomes your lifestyle,
Exactly.
and you can prevent a lot of diseases through that. It's not just cancer or anything. Once you make a naturopathy as your lifestyle, then you can prevent a lot and lot of diseases, and also you can stay happily in whatever condition you are.
Exactly.
It keeps you happy. So when we said practice of naturopathy, it means that having a healthy diet based on your problems. So that is what a naturopath can do, like based on
Yes.
your body type and what are the nutritional requirements, what is your need. Based on that, you can get a diet for yourself. You can fix your lifestyle, a schedule, at what time what to do, what kind of exercise is suitable for you, and all of those things. And through diagnosis, by different means of diagnosis, we can know that which of your body part is weak and it needs rejuvenation, as we can say. All of these ways
Exactly.
support in a preventive manner. So already after prevention, we have already spoken about management, as Dr. Deepika told us that management is not only that we are curing it, but during surgery, after surgery, how beautifully we can help the patients to recover or improving their quality of life. So any questions, please kindly ask. I think cancer is not such a common topic for people who have not experienced one in their family or one in person.
Exactly.
So they might not have any questions as such. But one more thing I have observed is when a family has a person with cancer, it is not only that person who is suffering, it is the entire family which goes through that trauma of leading with a cancer patient at home and seeing their symptoms so closely along with their treatment. So, how important is naturopathy for the caregivers in the home?
Definitely, this is a valid question, I would say. So we see day and out, we see caretakers here, right? So cancer is not like one day or 1 month or 1 year disease. So it's gonna be there for lifetime. Once it is there, it's there. Even after the surgery, chemo, radiation, the patient is actually vulnerable for recurrence. So we see patients party undergoing the same kind of stress. See, if you actually take out the stress, these days psychologists are more keen for a family also, because they are the ones who are closely being with the cancer patients, right? So the kind of trauma that the family is undergoing, it's equal to the cancer patient themselves. So we will have to look for the health care for caregivers as well. So yoga practices for this caregivers will actually help them a lot to be a better person for themselves, and to have this resilience for the cancer patients. I mean, they have to switch off after a while, right? So otherwise they will definitely be drained out emotionally. Basically, cancer is a very high budget disease. So economically, the patient is gonna drain out completely.
Because the sessions are not so short, like it's going to have finish off after 1 month.
Exactly.
It goes on, and chemo sessions also goes on and on. After a few while, every now and then we'll have sessions, and economically it is definitely very like it causes a lot of burden.
Burdensome, yes.
Yes.
Hmm.
And also there is a fear that if one in family has cancer, probably we may get affected later on in life, or further in our kids may get affected. That fear is always there. That once a person
Exactly.
has cancer in family, then it may go on and on.
Exactly. Very true. Yes.
And like before, as we see our ancestors, they didn't have cancers as much. But when we come to our generation, the cancer is more. But here we see a missing of genetic predisposition, right? It is not only a genetic factor which is passing through the generations, but it is by itself, like environmental factors playing a lot of major role.
Exactly. Yes. So, being aware of all of these will definitely help a patient or a caregiver to come out of this fear. For a patient, for a caregiver who is already with patient, definitely they know more about cancer than any of the other
Yes, yes,
doctors who are not into the cancer system,
yes,
onco system.
yes.
So for them, it's very easy to convince them to have a better lifestyle, to control it or prevent it in that manner.
Yes, yes. When we see cancer patients, like a person who is having cancer, if some of their family members have visited us, they tell us more about cancer than we know. Basically,
Exactly.
the person has cancer. So many study people do online, and also with the experience of their own experience with doctors and multiple therapies. They know so much about it, which makes us have a fear a lot more. The fear is
Exactly.
already there, but knowing all these facts, it increases. And
Exactly.
it leads
Yes.
to mental
Too
trauma.
much of our knowledge these days, we get everything free online.
Yes,
So, see, it's for every diagnosis, for example, we were talking on the symptoms, right? For every symptom, it need not be a cancer itself. There are differential diagnoses for every symptom. And if a person is having cancer in family, of course, you are vulnerable, but it's not that you have to get it by default, unless if there's a genetic mutation in place.
correct.
So even for the genetic mutation in place, there are therapies here now. So in fact, genetic mutation cancers are very well treated than normal cancers, because they know the gene mutation, right? They only target that, they give specific treatments and cure it.
Correct. Like even when we spoke about now that even if there is no genetic predisposition, you should be aware that you are not exposed to any carcinogens. It may be tobacco, it may be alcohol, or any chemical industrial exposure of chemicals like that. And
Exactly.
you are having a healthy lifestyle, then you need not worry. If you don't have predisposition or genetic predisposition of cancer, you need not worry. But if you are under influence of any of these carcinogens, then it may be a worrisome thing for all of you.
Exactly. Yes.
Yes.
So
And as on a lighter note, like when we talk, generally when we have a lot of hair fall, women usually say, have I got cancer? Like I'm shedding like a cancer patient. That is a general terminology. And slowly that turns into a behavior like checking online, like why is it happening? And then having the fear on and on about the cancer.
Exactly. But hair loss, definitely, hormonal influence will definitely be there. But chemotherapy will cause hair loss because, if I have to tell you in the normal layman terminology, chemotherapy is acting against cell division, right? So if we see what are the cells that on a daily basis, hair, nail, and all are GI mucosa, inner lining of the GI mucosa is something that is multiplying, proliferating every single day. So these are the cells that will be targeted first because we are trying to stop cell division. That's why the hair fall is in place. So the patient who is taking up these therapies need not worry. We have seen patients who come up with a good hair later in
Definitely.
years, like after 3 years of their chemotherapy, everything will be revived back. They don't have to
It not
be worried and get conscious.
cancer, right? It may not just be a symptom of cancer, it is a side effect probably.
Exactly. Side effect, yes.
Yes, yes. We have a good question here that what are the specific food habits we should carry out in our daily life? Like we commonly see, right? Having turmeric every day or lemon every day can prevent from cancer. Like how much potential does it have?
See, first thing is you have to see the stimulants. What are the stimulants? So having processed foods. If you actually cut down all of this, in a way you are actually I mean combating all of this in half a way. The next thing is you stop eating wrong things and then turn towards the right thing. Whole plant-based food is always good for prevention. I mean, homemade food, any homemade food will actually help you be in a right lifestyle. And antioxidants, all of these raw vegetables and fruits will give you antioxidants. Free radicals are the ones who is like blamed. I mean, this is the thing that we have been blaming all these years, right? Free radicals are the main cause for the cancer. So to combat that, you will have to include antioxidants, more of antioxidants in your daily diet. That's a very
Like
simple thing.
specific medicine or food to cure cancer or prevent cancer. Basically, the cancer causing foods should be cut out from your diet. Once you start practicing a normal healthy diet which you have been eating traditionally, that would be completely fine because Indian cooking, as I can say, has a lot of antioxidants in it. Like we are using turmeric on an everyday basis. We use a lot of spices in our food which have a lot of antioxidants, and seasonal fruits are available. So if you are
Exactly.
along with your cultural and traditional habits, that is having a healthy balanced meal and having including all kind of vegetables and fruits which are available seasonal and local, instead of just
Exactly.
the colored carcinogenic broccoli from the supermarket store, I would suggest to go out for a local greens which don't have carcinogens, obviously, because they are not loaded with colors or chemicals or whatever. So this is
Exactly.
that's it. There is nothing specific to do for prevention or management of cancer. Just be healthy, exercise, have normal food. I think that would be enough to prevent. If you don't have any genetic uh, predisposition for cancer, need not worry that much. You can just be like in a
We would definitely want to emphasize on physical activity here. Physical activity is a go. If you just eat good amount of food and then sit,
yes, that
definitely it is not going to make any
yes.
difference. So
Because lot
sedentary lifestyle is something that we have to look here. So one of the environmental factor I think I missed out, fat consumption. And any overeaten food is going to turn out to be a fat in body, right? So increased fat consumption is also one of the cause for cancer.
yes, that one point I want to add here, because of the fancy diets nowadays, people are just shifting to nut butters here and there. They're using like avocados, having a lot of nut butters and this high fat things. This is also very a nonsense behavior to start, I must
Exactly.
say, younger generation.
See, for any diet to be proven, it is going to help. So down the line, we need 100 years or
Yes.
good number of years to show the surveys and reports, right? We never know. Any extreme kind of diet can cause diseases. We still don't have enough data to prove that this will definitely not cause cancer.
Because
So balanced diet is a go.
yes, so many are there nowadays. They are just depending on one particular food group, mainly a fear for carbohydrates, I must say.
Exactly.
So they're depending on either full of protein food or a fat food, which is again going to cause a problem. Okay, we'll speak about diet is a very huge topic. We can dig deeper into it.
Exactly.
Uh, but basically,
Exactly.
just have a normal diet and don't worry about all these things.
Exactly. But the other thing is the main we didn't say about this, right? Cancer, stress levels, you will have to combat stress levels. If you think about cancer, I mean if you get scared about it, that is also a wrong thing.
Yes.
So obviously cortisol levels, it will never know whether you're thinking or if you're triggered with any stimulus and all of that. Cortisol levels in place will definitely cause many kinds of, I mean that will welcome different kinds of diseases in body.
Yes.
So stress is something that you have to combat. That will come up, that will be combated with physical activity, right amount of sleep is very important. 8 hours of sleep is very important for a body. For a person who is doing meditation, probably 5 hours of sleep is also okay, but for a person who is not into meditation, 7 to 8 hours of sleep is very much needed. That is when your stress hormones are revived back and your proper good hormones are released into your body.
Yes, definitely. That is why the importance of meditation and yoga has been a lot during these days, because all of our jobs is either a stressful job or a sedentary job. And here exercise and meditation plays a very important role. Exercise not only cuts down your calories, but also helps you to reduce this cortisol and reduce your stress levels. And that way also exercise helps beautifully. So all of these are the
Exactly.
you can just practice on an everyday basis. As we said, in caregivers or in the cancer patients, the quality of life goes so low that because of the stress levels only they face a lot of issue, and they even commit suicide, as she said. So to prevent all of these aspects, yoga, pranayama, exercise, it plays a very important role in the management of cancer.
Exactly. Very well said. Yes.
So we'll conclude with this. If any other questions, kindly ask. And if you have any other questions coming up with cancer or specific, we are always available. You can just DM or just contact us. Uh, Hopefully, if you have any doubts, we can have another session and we can clear your doubts. We can proceed with the session. Like we can make a series with answering your questions. We'll be happy to do
Yeah.
that. Any questions? And thank you for all of you who have joined, and some people have sending good comments for us. They are very happy
Exactly.
with this session. I'm so happy that they liked it.
See, the intent of the session only to give general awareness on cancer so that you won't be, you don't look this disease very foreign. So you know about this disease, so you don't have to be fearful. So there are medicines in place these days. So it's just that early detection will give you a good scope for treating a
Yes,
patient. Even for a physician, even
patient.
for that matter, patient himself will have good amount of time left out in his hand. So you don't have to hurry things. You will calmly take steps forward.
Yes,
So being aware of disease is definitely a good thing. You need not to be worried about it. It's just that you're getting a good knowledge on things.
yes. Because every family now has cancer, so it's that is why we took an initiative to educate about cancer, because it shouldn't be something like we are feared of it. Yes, definitely, when we have cancer, we need to take steps for it, and now we know what is cancer and how can we manage it. It is not that difficult, and as Dr. Deepika is giving us, there are a lot of patients who have recovered and managed well,
Exactly.
living a good life after cancer, after surgeries of cancer. So it is not something which you can never come out of it, or you cannot lead a life after it. It is nothing like that. you can definitely do it with professional help.
Exactly. We see all the celebrities doing campaigns for survivals. I mean, that's a hope, right? That's a hope. So these people are giving you hope to fight against the cancer and also be to also come back to the normal lifestyle. You don't have you won't be diseased person forever. I mean, you can come back to the routine as well by managing things. That's all. You can accommodate and come back to the routine. It's not like you will never come back to routine. So you don't have to fear for it.
Yes. Definitely, we have seen celebrities who are doing well now after recovering from cancer. So that is a hope that we all can get over it. Even if deadly disease like cancer, definitely you have a lot of scientific evidence. People have done a lot of research over it, and definitely you will be fine and you can overcome. But before curing, just let us practice healthy lifestyle and adopt naturopathic lifestyle so that we just don't fall into this trap first of all.
Exactly. That's very important. Yes.
Okay, thank you so much for joining everyone, and thank you, Dr. Deepika, for sharing such valuable insights and making a deadly disease like cancer so simplified that people are now okay. Yeah, now I understood that these are the things which are causing cancer, and I can avoid it in a healthy way. So there's nothing to worry about. People are now okay with it. So I hope this session reaches to a lot of people and let them get aware of the things for cancer. And thank you so much for making it so simple for us to understand.
Thank you, Apurva. I would want to thank you for giving me an opportunity to come on dais and speak on this, right? So this is something that we never touch. Though cancer is a lifestyle disorder, we are only scared to touch that disease and topic because we have no good number of people coming into this system and coupling that and all of that. But we see globally it is a need of the hour where integrative oncology is in place, mind body medicine is in place. So otherwise the quality of life will go down. That is what we have to summarize the session. The quality of life is something that we are looking forward with cancer patients. So for that to achieve, coupling naturopathy and all this alternative medicines with conventional medicine will is the only way forward.
This is a beautiful example. Like you are working in with closely with cancer patients in such a leading chain of hospitals. This is a hope for all of our naturopaths, that naturopath is not just mere some home remedies or just for weight loss or something like that, but we can beautifully integrate into any system and we can help no matter what a deadly disease like cancer. We can definitely help with our system so well, and we can integrate so well. That is a future of medicine. As everyone is saying that integrative medicine is a future, and we can see right with your example that definitely it is
Ex-
an example for the
yeah,
future.
yeah. Thank you, Apurva. Thank you.
Thank you so much. Bye, everyone. Thank you. Just
Thank you for joining.
with that you were with us, and if you are happy with it, just share your views on it. Suggestions, any suggestions, anything you have missed out, you can always watch the video on our Instagram handle. You can also comment for the questions. You can reach out to us at any time. We'll be happy to help all of you out there. Thank you so much.
Thank you, Apurva. Thank you, everyone.
Thank you, everyone.